All right, and good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions each Tuesday and Thursday on the Institute for Global Health Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions that we have received through the 26th of August, and we invite you to continue to submit your questions to us at NU Institute for Global Health on Facebook or directly by email at Global Health Institute at northwestern.edu. And leading the discussion today is Vinay Derbakula, who is an intern this summer with the Institute. So Vinay, I turn it over to you.
Awesome. Thank you, Kristen. I'm really excited to be here again. We'll start today's discussion with just some updated COVID statistics for the state of Illinois. The trajectory in terms of vaccinations continues to rise, and the state total has reached 50.2% fully vaccinated as of August 25th. Then we look at positivity in the per daily rate in Illinois. Today, and for the last 7 days, the positivity rate has been around 3,449 positive cases per day. This, when looking at states such as Florida, who have a positivity rate of 21,673 cases, and Texas, which have a positivity rate of 17,000 cases, looks excellent. However, Pritzker mandates that statewide masking in Illinois is going to be now a mandate across the state. And so masking and as well as any other mitigation efforts have begun to increase as the Delta variant becomes more rampant. And because several hospitals have reported a warning level in terms of ICU bed availability as people become more hospitalized due to the Delta variant, more is potentially coming. So it's not a question anymore in terms of whether or not mandates need to be implemented. They're coming, and they have been implemented at a pretty rapid rate recently. But then the biggest headline that will be mentioned today is referencing the booster shots, as it has been now announced that the booster shots, what had originally said it was 8 months, are now going to be available after 6 months. And so, Dr. Murphy, I'll turn it over to you. Why may that be the case?
Yeah, so about 6 weeks ago or so, the CEO of Pfizer just came out and mentioned that, oh, by the way, the neutralizing antibody levels are dropping about 8% every month or two, and that people are going to need boosters at 6 or 8 months. And I think they mentioned 8 months at the time. So remember, there's the immune response is more than just these antibodies. There's the T cell response and everything else. However, the antibodies are the easiest to measure, and they are really a marker of the overall immune status. So, that immediately, when he made that announcement, was pushed back by CDC, the NIH, all the academies and stuff. Oh, you're jumping the gun. Plus, he knows more information than they knew at the time. So when everybody looks at all the data, they say, oh, you're right. These antibody levels are going down, and they're seeing increased admissions to hospital and sicker patients who've been vaccinated. And that cutoff was originally thought to be 8 months after the second dose, but looking at it even more closely, they've adjusted that down to 6 months. Now, the emergency use authorization is going to be for the booster dose is going to be for 6 months, and that should be issued sometime in the next couple of weeks. People are already, voting with their feet and getting their booster doses already somehow. Now, this is different from the immunocompromised patients who the EUA, emergency use authorization, was approved a couple of weeks ago for people with immunosuppressive therapy, steroids, organ transplant patients, and the like. They can get they're considering that like a third dose in their schedule. So it's semantics here, whether you call it a third dose or a booster. It's the same shot. There's no difference from what you took originally. It's the exact same thing. So whatever it is, they can take it now. Everybody else who's 6 months past their second dose will soon be formally approved to take it.
Got it. And so now we're 2 days removed from the FDA approving the Pfizer vaccine, and it looks like the approval of the Moderna vaccine is coming in the future. What does that mean in terms of mandates? Have we started to see an increase in mandates? Or, yeah.
Yeah. Well, technically, you don't have to have the full approval to have a mandate. There have been mandates in many hospitals and some businesses already have been put into place. However, some companies and agencies, institutes are a little bit nervous putting these kind of strict mandates into place under emergency use authorization. So since now it's fully approved, the Pfizer and Moderna will come shortly. The use of mandates, I think, is going to really increase substantially. So the city of Chicago has done it. The state of Illinois is considering it. Northwestern Memorial Medical System, their network of 10 hospitals, they're one of the last big chains in Illinois that have mandated their employees all get vaccinated. That's just about everybody, all the healthcare workers. The whole state of New York, all the healthcare workers have to be vaccinated. The military, active duty, 1.4 million people have to be vaccinated now. The military waited for full approval. So there's a variety of entities out there that are doing this now. So it's going to be just, you're going to see every day another company, another entity, another venue. Lollapalooza required vaccination of those 400,000 people going to Lollapalooza, that or a recent PCR or a recent test of some kind. So, and it looked like that was effective. So, you know, you're going to see this is going to happen. And so what will happen ultimately in the next couple of months is that people that that remain unvaccinated are going to have very difficult time maneuvering in public areas and in institutes and in the workplace. Cruise lines now are mandating it. And these mandates, mandates for vaccinations have been around for a long time, for measles, smallpox, rubella. And so they've held up in the court system. So the Archdiocese of Chicago, just the other day, has mandated all its thousands of employees to be vaccinated with no religious exemptions allowed. This is interesting. Yeah. So you're going to see just a slew of mandates come rolling out over the next couple of weeks.
And I mean, we've seen that since yesterday, even with Chicago announcing mandate for vaccinations for all city employees. So yeah, it seems like it's a continued increasing trajectory, and hopefully with the approval, it'll only continue.
Yeah, and it's the Kaiser Family Foundation recently reported, and this was discussed in the Washington Post yesterday, that of the unvaccinated people, there's about 31% of them would be more inclined to get vaccinated if there was full approval. They feel safer in that regard. And so that's another group that could switch into the vaccinated group.
Oh, awesome. Well, we can now move on to the viewer asked questions part of the segment. So we'll start with a question that we've seen a few times. Is just the fact that a recent Mayo Clinic mentioned that the efficacy rate of the Pfizer vaccine declines from 76% to 42%. But the Moderna vaccine declines from 86 to 76. So the question is, does the efficacy difference between the two vaccines indicate that Pfizer is better and that people should be switching for their booster shots? Or is the booster shot the same, but also is there data that's actually conclusive on this?
All right. This is a good study. However, it doesn't really answer the total question, because it's just one of many studies. There have been other studies in places that have looked at the efficacy of the Pfizer and or the Moderna vaccine and have not seen this dramatic a difference. So you have to take it as a group. You can't be driving all the policy based on one study. It's got to be reproducible. You have to look very closely at these 80,000 people that they looked at. Where are those patients from, whatever. But these technologies are very similar. The overall efficacy rate was almost identical. So a lot of it could be, Moderna came second and Pfizer was first, and so I mean, there's just too many different variables here to draw a conclusion from this. It's interesting data. It's part of the data set. We're discussing it now. But frankly, the mRNA vaccines are almost interchangeable.
Right. And I mean, I've seen several studies that show very different results. And so without any conclusive evidence, there isn't a definitive answer whatsoever. But
Yeah.
The next question is something that's also very frequently asked, and it's regard to travel. And so several people are just wondering if, well, first of all, the people who are asking the question are in their early 60s and they're fully vaccinated. They're planning on attending their son's wedding in Cancun in December, and they're bringing their 92-year-old mother as well as their 1-year-old granddaughter. So the question is, how safe will all of them be? What should they be doing to make it a little bit more safe? What precautions should they be taking?
Yeah. Well, first of all, the whole situation is so dynamic right now that it's actually impossible to predict the safety level for the safety risk, the risk of traveling in December. We can't do it. We don't know, what's going to be happening in Mexico, what's going to be happening here. Is there going to be another variant or what's going on? We're still in this going up in this peak.
Right.
So anyway, Cancun is not that far. And there's a lot of good things about Cancun. However, at this particular point, I don't think taking a 92-year-old person there, if they get sick there, it's really going to be difficult.
Right.
You got to get that person out of there, really. I mean, the care is okay there, but if a 92-year-old gets COVID and gets really sick, first of all, they're not going to be able to get on a plane to get back if they're sick. This happened to 2 colleagues of mine who were in Africa, who felt fine, went for their test. The test was positive. They couldn't get on the plane to come back to the US. And both ultimately got sick. And there was very limited healthcare resources. And they were in Zimbabwe in Africa. And both of them died there.
Wow.
They were in their 60s, I would say. I don't know the underlying conditions or anything, but I mean, traveling around with a 92-year-old, I think, in the pandemic is probably not a good idea. And I think the same thing for the 1-year-old, and just that, the 1-year-old is not protected. You can't wear masks on a 1-year-old, and you can't vaccinate them. So I would think it would not be wise to take a 92-year-old and a 1-year-old to a wedding like that out of the country.
Yeah.
Or to even many states like Florida. I wouldn't send anybody to Florida.
The next question is regarding the combination of taking a vaccine booster and getting a mammogram. Have there been any complications that have been reported while doing both at the same time? What would you recommend this person doing if they have both of them do at the same time?
This has been reported for a while now, and that what happens is when you get the vaccine, it causes this local immunologic reaction as well, and sometimes some lymph node swelling. So in a mammogram, they're looking very closely at the lymph nodes. Yeah. And so the lymph nodes can be swollen. That's going to make the radiologist very suspicious that something is going on related to the breast, the cancer or something. So this is not good. And those will go down. But what I would suggest is that the person get the mammogram first and then get the vaccine.
Got it. And then they're also just curious, and this had been brought up before, but just, is it okay to change up the booster dose from the initial vaccine you got, or what is the policy in terms of?
So the recommendations are that you try to stick with the one you got originally and use that. So, but in some cases, in wherever you are in your local setting, you may not, say you got the Moderna 2 doses, and then you're ready for your booster, and there's no Moderna vaccine around where you are, well, is it better to wait until you can find it, or is it better to get a booster with the Pfizer, which is the same sort of technology? So in that case, it's better to get the shot earlier rather than wait and continue to look around for the one you can't find. For the Johnson & Johnson one, what people are doing, I don't know if it's formally recommended or not, but people are getting the mRNA vaccine as the booster. But Johnson & Johnson has just done a study, and the information is public in 360 patients where they got a second dose of the Johnson & Johnson vaccine, and they had this tenfold increase in the antibody levels.
Yeah.
So it looks like that works too. So, they're all applying for, EUA approval for these booster shots. The other thing with the Pfizer is that they have an ongoing study right now with 2 doses versus 1 dose, 60,000 people.
Yeah.
So that hasn't been completed yet, or the results are not available yet. So we'll find out if 2 doses of the J&J vaccine is better than 1 dose. So that's a kind of a different question, but that's going on in the background now.
Got it. The next question is about an elderly person who is undergoing physical therapy for bursitis in the hip. They're taking steroids, 6-pack steroids, and they're currently feeling very free, lack of discomfort, but they do have 6 more sessions scheduled at the physical therapist. So the question is, they're vaccinated, the couple, and the therapist is vaccinated, but they don't know the status of anyone else in the clinic, whether it's the therapist or the patients who are coming in. And so they were just wondering if it's advised to continue going to this physical therapist without knowing those vaccination statistics.
There's a couple things about this case. One is that this person had a pulse steroid, a short course of steroids. So this is not the same as somebody who's on high dose steroids for a long period of time. So this person should respond to the vaccines and the booster. That should be okay. Regarding going to Athletico, where some of the people may be unvaccinated, that's another story altogether. And this is up to Athletico to sort of, they've got to come around, and they should consider requiring mandatory vaccines and masks for everybody that's going in there, just like all other, if this is a physical therapy place, they should act like all the other medical facilities and require vaccination for everybody.
Awesome. The next question is regarding a 65-year-old person. They're taking medication for a colitis, and they're immunosuppressed, and they qualify for the booster. And they're wondering if they got their second dose in February, is it's too soon to get it if they're immunosuppressed?
Yeah, no, so this is a little bit of semantics also here. So this person is 65. They're taking azathioprine for ulcerative colitis. It's an immune suppressant. And they qualify right now to take a 3rd dose as part of their original regimen. So it's technically not a booster, but it's all the same thing. It's just right. We're calling one a booster, one a 3rd dose. But they can take it now because they probably didn't respond as good to the original vaccine because of the azathioprine. Right. So they can just get it now. Now they're already over 6 months. It's going to look like a booster, but they should just get it now.
Got it. Awesome.
And then they get a booster 6 months after that.
Right.
Okay.
Right. The next question is regarding workplace, and the person is saying that they're vaccinated. They work in a small office, but half the coworkers are unvaccinated, and the coworkers are not required to wear masks. So most of them don't wear masks. And this person is concerned about catching COVID and bringing it home to a diabetic family member. So they're just wondering what precautions they should be taking. What should the company be doing? What's the status there?
Well, I think this is one of those situations where this company has got to make a hard decision right now during this pandemic. Right now, things are out of control everywhere. Even in Illinois, our numbers are good, but they're still bad. They're just not as bad as Florida and Texas, Alabama, and everybody. But anyway, so this company needs to step up and just say, hey, everybody's got to be vaccinated by October 31st or whatever date they select, unless they want to get into some frequent testing schema or whatever. It's starting to happen. I can't mention the companies by name because it's confidential, but I'm dealing with several companies in this exact same position.
Got it.
So nervous people are going to leave, whatever, but you got to think about the health of your workers and their families.
Yeah.
And this mixing of the unvaccinated and the vaccinated is just a recipe for disaster.
Yeah.
So for the person, what they do in the meantime, they've got to wear their mask everywhere in the office, including in their little office, because unvaccinated people are going to come in. And when someone comes into their room, that person should require them to put a mask on.
Yep. Okay. And then our last question regards a family of 7 who went on a trip to Florida and all came back with COVID. They were all completely vaccinated. They're wondering because the husband is on the liver transplant list at Northwestern, and the doctor has mentioned that they need 2 negative test results in order to continue with the process. So they're questioning how long should they be waiting for the husband to get tested?
Yeah, no, this is a tough question, but it brings up a couple points. One is travel to the super high risk, out of control states is not a good idea. It's just not a good idea. Look, a whole vaccinated family going to Florida, they thought they were safe because they were vaccinated. All of them get infected. Amazing. And the one person is immunocompromised, needs a liver transplant. This person is really sick. So anyway, the hospitals are going to require for a transplant that you have a negative molecular test. Now that doesn't mean you're infectious, but it's going to pick up particles of the virus. And this can go on for weeks or months after the infection. So this person can start getting tests. So we don't recommend that routinely after you get infected, that you even need a test after 10 or 14 days. You're just considered cured.
Right.
This guy's got to take the test to get into the hospital for the transplant. So somewhere, 2 to 4 weeks out, he can start getting tested. But don't be surprised if this is positive for many months. He's going to need 2 negatives before he's going to get back on the liver transplant list. It's not going to hurt to have too many tests, but it could take a while. I've had one patient who had a immune compromising condition who actually tested positive for a year.
Wow. Now,
that may be a real outlier. And this person, I don't think they're on immunosuppressives now. They just need a liver transplant.
Right.
So, hopefully that's not going to be the case, but don't be surprised if it's positive a couple of times, but ultimately it should become negative.
Got it. All right. Well, thank you so much, Dr. Murphy, for your time today. That's all the questions we have.
Thank you, Vinay.
All right.